Hey, good morning, everyone, and welcome to the show. I'm your host, Vic Sinise. Glad to have everybody here. If you're watching us live, you're seeing us from any of these platforms: X, Facebook, LinkedIn, YouTube. Any of those are there. So great to have you all that are watching us live, and of course, those who watch us on StreamYard. Um, if this is your first time checking us out, be sure to go to our website at uronurse.com. Best place to go to learn more about the show. It's also the best place to see all of our past episodes. And we've got a bunch of them there, 130 to be exact. This is episode 131. So we've been doing this for a while. We come to you every week, every Saturday at 9 a.m. Central Time without a hitch. Now, I found out that a lot of you like to listen to us in your car. No problem. We do have our audio podcast available on all your favorite podcasting apps. So go to our UroNurse Plus area and just click to whichever way you want to hear us. Every episode becomes a audio podcast in about an hour after the show, and you can listen at your convenience. Now, we got a great show for you today. We're going to be talking about the Advanced Urologic SUNA meeting that's coming up soon. And I've got a whole bunch of experts from SUNA that are going to be joining the show to talk about that. And let's go ahead and bring in all of those experts right now. Experts, welcome to the show. How's everybody doing today? Don't forget to take your mics off of the mute so that we can talk. I'm going to let everybody do their own. I've got a lot of people here. I'm going to let everybody do their own introductions. As I mentioned, my name is Vic Sinise. I've been involved in SUNA for most of my career, been the past president of SUNA, so I'd still like to be involved in. Last year, I won the President's Trophy, so SUNA has always been a big part of my life, so enjoyed that. But let's swing some of you in here to give your introductions. Let's start with Jason. Go ahead and let us know who you are and what your part of you play in SUNA. Jason, not hearing you. You must have something muted.
Is that better?
Perfect.
All right. Good morning, everyone. My name is Jason Casey, nurse practitioner out of Akron, Ohio. I've been a nurse practitioner with urology for coming up on 10 years. Currently now serving as one of the directors at large for the board of SUNA.
Oh, great. Glad to have you on board.
Thank you for having me.
And Tabo, welcome to the show.
Thank you. So I'm Tabo Mwikisa Kelly, and I have been a registered nurse for 10 years. I'm currently practicing in the state of California, and I'm a registered nurse at Marine Health Urology Clinic.
Great.
And I've been, I've actually been in urology for 9 months. So.
And did you mention what you do for SUNA?
I'm just a member of SUNA, but hopefully I could do more in the future.
There you go. Never just a member. You are a member. Bethany, welcome to the show. Give us your introduction.
Good morning. My name is Bethany Purcell, and I have been in urology now for 8 years. And I live in Upper Sandusky, Ohio, so very rural, critical access. Right now, I do inpatient and outpatient urology, but in a month, I'm going to be opening my own sexual medicine and pelvic floor practice. We're taking that part of our practice out and really trying to focus that because those patients, deserve more dedicated care. So we're excited about that. I've been a member of SUNA since I've started my urology career. And now I serve as a director at large, and I'm really excited to be a part of this. So thank you.
Great. Glad to have you on the show. And Andrea, stranger to the show, go ahead and give us your introduction.
Good morning. My name is Andrea Strong. I have about 15 years of experience at the bedside, both as a nurse and a nurse practitioner. And I'm coming to you today as a director at large for the Society of Urologic Nurses and Associates. And I also served as the board liaison for the conference planning committee for this advanced conference. And I wanted to thank all of our volunteers who helped put this together. They spent countless hours volunteering to bring you the best 2025 Advanced Practice Urologic Conference.
Great. All right. I'm going to go ahead and bring your slides in if you can go through your show for us.
All right. So we have our Advanced Urologic Conference, and this is an annual conference. We also have our Urologic Conference. That's also an annual conference. That's designed for everyone and any specialist in urology. And the Advanced Urologic Conference is for those who are of a more advanced practice. So maybe you're a nurse practitioner, a physician's assistant, a clinical specialist, or you just are in an advanced stage of your career and would like that additional information. We do have some discount rates if you are able to register by Monday, February 3rd. So where is it? When is it? It's coming up very soon, March 14th through March 16th. So it starts Friday around 1 p.m. That's our opening sessions. There's also an excellent pre-conference session that we'll talk about after our presentation. And then it ends on Sunday around 1 p.m., giving you plenty of time to get home to your family. Or if you want to extend your vacation, I'll give you some ideas for that as well. And it's located in Sacramento, California. So what's the investment for this conference? If you're a member and you'd like to attend the entire conference, the investment is $475. If you'd like to pop in for a one-day registration and you're a member, the cost is $250. There's a total of 14 continuing education credits, 9.5 for the live conference. And then for all of you who attend, there's an additional 5 pre-recorded sessions that are on demand that you can watch whenever it's convenient for you. Early bird registration. If you register by Monday, you're going to save $50. And I'm going to talk to you in a few minutes about ways that you could spend that extra $50. This year, we really focused on enhancing and increasing the quality of our presentations, making it very innovative and exciting for all of our participants. Here is one of the highlighted sessions on kidney cancer, diagnosis, treatment, and beyond. A few of the other sessions I'd like to highlight are self-preservation, thriving among exhaustion, prostate cancer uncovered, spotlight the precision focal therapy, the male lumpectomy. And that's presented by our very own conference chair, Lori Goulman out of Sanford, and navigating genitourinary radiology for the advanced practice provider. Couple highlights here. As I said, this conference planning committee, in conjunction with our AJJ conference planning staff, they've really delivered a high quality conference. You can explore the latest advancements in urology nursing practice and beyond. You can engage with leading experts in the field, and there are plenty of opportunities for networking. You can also gain actionable insights to enhance your clinical skills, things that you can bring back into your practice immediately. And it is a very fun conference. There's a wine and cheese product theater. There's also an exhibit opening reception that we'll talk about a little bit later. And if you didn't know, there are many exciting things that you can do that are within a 2-hour drive of Sacramento. One that has been on my bucket list for a long time is Napa Valley. Of course, you have wine tasting, there's hot air balloon rides, there's the downtown Napa area, and it's only an hour and a half away. Lake Tahoe, you can do skiing, you can do snowboarding, you can do scenic drives, and that's also really close by. There's also Yosemite National Park. They've got beautiful waterfalls and mountain views from what I understand. Again, I haven't had an opportunity to do that myself, but if you'd like to extend your experience, you could come a little early or extend it by a few days and just take a short drive to some of these places. final tips and takeaway, I'd like to do a call to action to everyone listening today. If you're thinking about advancing your career, if you want to network with other professionals, if you're looking to get certified soon, these are all great reasons to come join us at the Advanced Urologic Conference coming up in March. I also want to point out that if you're not able to come in person, you can purchase the recorded on-demand sessions as a package after the conference has been completed, and you can watch those from the comfort of your own home. So please join us for an unforgettable learning experience with collaboration and professional growth. And you can get more information and how to register at SUNA.org. And now I'd like to open it up to all of our panelists to have a deeper discussion on this conference.
Great job kind of giving us a little nugget of what's going on, but we'd like to dig a little deeper. And those of you that are watching this live, feel free to put any questions or comments you might have for our experts. They're here to answer those questions into the comments. We'll bring those up, but I'll let you guys take it away a little bit and explain some more. So who'd like to lead off?
I can start and cover the pre-conference session. So in the guidelines for overactive bladder, we have third line therapies. And what is actually been happening at the bedside is a lot of our medications that we use are, expensive or no longer covered on insurance plans or put in a more expensive tier. So, or, they're on the beers list that it's not safe for our geriatric patients. And we need a method to help these patients with their overactive bladder symptoms or incomplete bladder emptying symptoms. And advanced practice providers are really the ones taking care of these patients and are skilled and knowledgeable on how to navigate through the overactive bladder pathways. And so Medtronic is one of the companies out there that provide third line therapy called neurosacral modulation. And when I explain it to my patients, what it does is helps the brain and the bladder talk to each other better. And it will help with symptoms of frequency, urgency, urge leaking, and incomplete bladder emptying. So in the office, you can do what's called a peripheral nerve evaluation. And this is essentially a try before you buy. Of course, the patients have to buy it. It's insurance covered, but it's a trial before getting the actual implant. And advanced practice providers can perform these trials in the office. And so this pre-conference will actually teach you how to identify the landmarks and the S3 and S4 foramina, which is where our needle will actually go. Sacral nerves control bowel and bladder. So we will put the needles in there, and then once we get a response, then we connect it to a battery, and the patient wears it around for about a week, and we see if they get improvement. And if they get about a 40% improvement in their symptoms, then we know, hey, they're going to be excellent candidates for the implant. And then you can work with your surgeon to provide the full implant. But it's a tool that we can have in our toolbox as advanced practice providers to better provide for our patients. And a lot of times you have to go to certain areas to learn this. So it's really excellent that SUNA was able to coordinate this and bring it to our members and learn this. So it is great. You're going to learn everything right there. To me, this is worth going through the whole conference just for this. So it's, and again, you need to be able to be prepared to provide these therapies to patients, and patients are getting more and more complex, and we're seeing more patients at advanced ages or even younger patients that would qualify for this device. So how can we rise up and practice at the highest level of our education to meet our patient needs? Is there any questions about the PNE?
Yeah. Is there something new that advanced practice nurses have gotten into now with the pre-testing for sacral nerve?
So there has been pockets of advanced practice providers doing this, but what we've learned is there's a greater demand for third line therapies, and we have really capitalized on advanced practice providers are trained to do this, and we're the ones seeing these patients. So it is something that has been around. A lot of reimbursement has changed to make this more feasible for in-office evaluation. And Medtronic has really been partnering with organizations and providers to get this in the hands of the folks actually taking care of the patients.
Yeah, that makes a lot of sense. All right, let's bring Jason in here.
Just to kind of piggyback on what Bethany was saying, I recently started doing these in the office as well, these evaluations, and I can attest firsthand that the training that Medtronic provides has been fantastic to really get more advanced practice providers engaged in this trial therapy. I mean, if you think about it, I mean, there's only so many procedure spots and surgery spots for, surgeons. So this is really a good way to get any advanced practice providers who are interested in something procedural involved more in overactive bladder therapies for patients. So,
yeah, definitely makes sense to put people where the need is highest. So, to get enough providers to provide this. All right, Tabo, I think you had a subject you were going to talk to us about.
Yes. So what's a conference without any exciting events? So the good news is we have some exciting vendors. If your institution allows you to participate in some of these, please feel free to visit them. So we have Merck sponsored theater on Saturday. And then also you're in wine country, so why not have some wine and cheese? That'll be sponsored by Jim Tesser. So look out for that one on Saturday at around 12:25. And of course, we also have Medtronics. And it's also a good way to interact and network with those you haven't met. I feel like this will be exciting. And of course, I look forward to it.
Sounds good. I always think that the best way to kind of get conversation flowing is with some wine.
Absolutely. I agree with you.
All righty. Jason, were you going to talk a little bit about the conference?
Yes, I think one thing that I'm curious about this year to see how it works out, we're trying to definitely make this the most, action-packed as far as different topics and things like that for the conference. So Saturday, we're doing a little bit of a different format. Instead of making hour-long sessions, we've shortened them to 40 minutes. So that'll allow just for a few more CME to really make the conference that much more of a value to any of the attendees.
Are you still getting a 1 hour contact?
You are still getting, I think the 40 minutes was kind of going to be the bare minimum that they would allow for the 1 hour continuing education hour.
Mm-hmm. As somebody who sat through many a conference, I appreciate making them shorter.
Yeah. So again, it'll allow for just a few more sessions on Saturday, which obviously is more options, but hopefully too, it'll help with a little bit of fatigue. So you're kind of mixing things up a little bit more often and having to sit there for an hour or so.
That's great. That was great planning by the committee. All right, I'm going to bring some questions up here. Again, if you have any comments in the audience, feel free, but I've got a few I'm going to bring up myself. Can you tell me what are the key themes and focus areas for this year's Advanced Urologic Conference? Is there something in particular we're looking at? And whoever wants to take that, just let me just put up a finger. All right. Go ahead, Andrea.
Thanks, Vic. This is a great question. This year, there's not a very specific theme. I'll say we're not focusing on any particular area of urology. What we really wanted to focus on is a conference that meets the need of all participants and all comers to this conference. But what we're really focusing is on doing things that are more practical, such as case studies, deeper topics. We are even talking about AI in urology. And, I think when you go to these conferences, not only is it really fun and you get the opportunity to network with other people, but it brings so much more joy to your practice when you feel really confident about the information that you're giving to your patients and the care that you're delivering. I always found that I had an extra pep in my step after going to any urology conference because I had new knowledge to share and I was just feeling more confident about my practice.
Yeah, I think it's true. It does kind of motivate you, I think, sometimes just to push yourself a little bit further.
Yeah, absolutely. And I'd like to just point out that for this conference, you don't have to have a license as a nurse practitioner or physician assistant or a clinical specialist. If you feel that you're at that advanced level and you're seeking that knowledge, you are welcome to come to this conference. In fact, the first advanced conference that I attended, I had just started in my DNP program and I had been working in urology for a while. So I thought it was excellent and a great way to start, to dip my toe into that extra advanced practice at that point.
So I wanted to know, how does this conference differ from previous years in terms of content and format? And I think, Jason, you were talking a little bit about the shortened amount of time, and maybe you can expand a little bit about other things that might be different.
Yeah, definitely. So yes, like I said, the 40 minutes, that's going to be for a Saturday only. Obviously, if we'll listen to feedback and see if that's something we want to expand further for the entire conference. But for this year, it will be just for the Saturday sessions. And then as far as content goes, we kind of talked about just kind of a variety of things, and Andrea touched that there's not a universal theme, but just kind of doing more to kind of help with, feedback that we've gotten from over the past conferences on what they want more of or less of, or things like that. So to put a plug out there for everybody who's on, if you do attend the conference, please in the feedbacks, let us know what you liked, what you want more of, what you felt like was not as helpful. And even if you don't go, if there's something that you think that, hey, I would like to see this, and this would maybe prompt me to attend, please let us know. Just any feedback at all. The board really does consider that when they're trying to find speakers and develop topics and things like that for future conferences.
Yeah, I think that's an important point, because I think sometimes by the end of the conference and I'm filling out that evaluation, I just want to get it over with and not think about that. But, then the next conference comes along and it's the same old because you didn't really put your input into it. I think it's
Correct.
really,
Correct.
I'm happy to hear that, you guys are listening to comments that come in and making some of these changes. I think those are
100%.
really big.
Yeah, we really do.
Right.
We really do consider the feedback.
All right, next one. How will this conference benefit both new and experienced urology professionals? Anybody want to take that one? All right.
So Andrea alluded to this, that you don't have to be advanced practice provider to benefit from this conference. We have a lot of nurses and MAs that have been urology focused for a long time, and they add so much knowledge and richness to our patients and our practice. And the more that we are able to collectively educate ourselves and rise up as a urologic profession, the further that we can advance the profession and do better for our patients. So I think that is a really important piece, that you don't have to be an advanced practice provider to attend and benefit from this conference. And then also, you can come into this as a brand new provider or an experienced provider and gain knowledge. We know practicing evidence-based medicine, you need to continually learn and gain new knowledge. But I think when I first attended my first advanced conference, I was a little intimidated because I was like, gosh, I don't know anything. I'm brand new. And everybody is so welcoming, and they make sure that you are valued and that you have the opportunity to learn as somebody new. And then, now myself doing this for quite some time, I still go and I learn something, and it adds richness and value to you as a practitioner, but then to your practice. So anybody's welcome. The more the merrier. It makes everything better.
Yeah. I think that's a great point that you made too, is you don't have to feel intimidated. Like, I'm attending and I don't want to, maybe I don't feel like I'm qualified for some of these meetings. And I think, as Andrea pointed out, you don't have to have all these initials behind your name. Nice to get them, but you don't have to have them. If you're practicing at a high level or want to know more, this is the conference for you. This is, this isn't your nuts and bolts urology. This is that next step. I think that it's always important to be advancing yourself. I'm going to bring this next question up for you, Bethany, because you're kind of touched a little bit on the hands-on areas. So what hands-on workshop or interactive sessions can attendees expect? And I know that from being involved in SUNA in the past, they've always had this kind of hands-off approach to hands-on. They don't really like to get too many things where you actually get to do stuff. So what's with the Medtronic? Is this going to have any hands-on component to it? Why don't you allude to that?
Yeah, absolutely. So again, with the Medtronic, you're going to learn where the landmarks are. So touching, feeling, and then you'll actually learn how to drop the leads. So that is very hands-on. And there is, because a lot of offices, especially like in rural clinics, you don't have the ability to use fluoroscopy. And there are some bigger practices that have fluoroscopy right there. So that knowing the hands-on landmarks, you have a backup. But in rural practices, you don't have the advantage of fluoroscopy. So you have to get really good at the hands-on part. So you're going to learn really good assessment and anatomy skills with that. And then we also have a lecture on pelvic floor physical therapy and how it can help patients in urology, specifically with interstitial cystitis. And that is super important. Not that we're expecting our urology providers to go and do PT, but to be able to assess and figure out, okay, how do I best help my patients? So hands-on is tricky, because it's, how do you get live people? How do you get cadavers? All these things cost money. So we're really trying to figure out as an organization, how do we pull that in? And so I think that's one thing that this conference is really trying to do, is to figure out, we can do this, and how do we do it well?
Yeah, no, that's a great point. And I'm glad to see this happening, because I think that you need that hands-on experience, somebody there who's experienced not only just, putting slides up and talking about them, but to kind of go over with you, hey, here, these are the landmarks, to get that comfort level that, yeah, I can do that. So thanks for taking that question. All right. How can members contribute or get involved in shaping future conferences? And I'm going to bring that to Jason again, because you had kind of spoke a little bit about the filling out those forms properly, but what else can we do to get involved?
Yeah, definitely. All members definitely have access to help with different committees, and there are planning committees for both the Advanced Urologic Conference and the Urologic Conference, the annual conference in the fall. So, getting involved on that level, if you don't want to do the time commitment, like I said, definitely filling out surveys, or, jumping on UroConnect and just kind of maybe commenting, because we do check those. And just like I said, if there's anything specific that you have questions about or want to get involved with doing, or if you have just feedback that, maybe you didn't do your evaluation, but you're just saying, hey, is this something that we can have at a future conference? Like I said, we are very in tune into all these different avenues of getting feedback from members. So,
are there any advantages to joining the committee, such as discounts for attending the conference or anything like that? Something to entice me to be on a committee. I'm from Chicago. You don't bribe me.
As of now, no, but that's definitely something that can be considered. So yeah, definitely. Yeah, we can talk about that one.
Tabo, you had a comment?
Yes. So I will add, well, the benefits of being a member was, for me, I get to go to the conference for free, because I did participate in organizing the conference. So I think that's a plus. And being new to urology, I've actually used SUNA's Connect. Was it you call it SUNA Connect? I can remember.
UroConnect.
Yeah. So I have actually utilized that to get feedback from other, urology nurses or advanced practice nurses on things that I'm not sure of in my own clinic, and everybody's pretty responsive. And it actually motivates me to even do better as a urology nurse. So there are some good benefits.
Yeah. Yeah. Great. I'm glad that you brought that up, Tabo, about UroConnect as the #1 contributor to UroConnect. No surprise, because I promote the show, and actually my two of the podcasts are promoted on it. The newest one being the Dr. Jeff's Sex and Intimacy Talks every Tuesday. But I think that it's underutilized. I mean, there's a lot of nurses that belong to SUNA, and I think that really there's a lot of things that can be done. I've done a few surveys through that and had some really interesting results come through that. Not that you're doing, a really extensive research, but just some general questions and things. A good question out there is, what are people doing about some of the shortages of supplies that have been caused by these, many disasters we've had recently? We're having trouble getting our biopsy needle guns right now. I think these would be great things to utilize UroConnect if you've got some idea how this can, be helped, or you've figured out a solution. Share it. Get on UroConnect. It's super easy. All right. I'm going to bring up another question here that I had. What do you hope attendees take away from this conference, from this year's event? I'm going to let anybody who wants to talk go ahead. Andrea, great.
And I think probably each person has their own unique answer to this question. But what I hope that the conference attendees come away with is inspiration on advancing your career, making new friends. Some of my oldest friends are actually from the Society of Urologic Nurses and Associates, and just bringing some joy and some fun into your everyday practice.
Yeah, that's great. Go ahead, Jason.
We kind of touched on this earlier, but I just hope a different insight or outlook. As Andrea talked about before, you don't have to, be an advanced practice provider to, attend the conference. And I think some of the past ones, some of the best conversations have been with different levels of people in their career. It prompts different conversations because you have different points of view. So I do encourage anyone who's out there who is not an advanced practice provider to still consider this, because it just brings a different view and how you see things, and the questions that are prompted. So
great. Anybody else with any comments? Go ahead, Bethany.
I just really hope that folks leave this conference and feel that what they're doing matters. And because we all matter, and we bring value to the profession, and we matter to our patients. It's really easy with today's practice environment to feel burnout. I know that's a very cliche and catchphrase, everybody's using it, but it's, you go to these conferences and you get together with other like-minded individuals to prevent burnout and to better your practice. And so leave this conference and realize what you're doing matters, and you bring so much value to the urology space and to your patients. And I mean, going back to, why should you be on a committee? Why should you be a part of SUNA? Because you matter, and what we're doing matters. And if you get nothing else from it, feeling of a belonging and that you're making a difference should carry you through. And that's what we want to give to people.
Yeah, well said. All right, I'm going to wrap up today's session here I'm going to put this out to everybody, so you're all going to get a chance to make a comment. I'll kick it off so you have a chance to think about this, but I've been to a lot of conferences. I've been in urology for 40 years, and I've been around before SUNA was called SUNA. But there's always some conference, I think, that maybe had some special event, something that happened that really, I think, is memorable. And I'm going to ask you to think about what one memorable event that you have from a conference. And I'm going to kick it off. We had a conference years back. This was a general session one, and it was in Kansas City. And we got a bunch of people from the SUNA conference together to go to a spook house. Now, this was no ordinary spook house, because a lot of those conferences are right around Halloween. And those of you that maybe have participated remember this. This was a whole factory converted into, the place from horror. They had live actors running around with chainsaws, and it was crazy. And here I of course, one of the few guys in SUNA. So I was the guy that was in the front of the line because everybody's behind me saying, you go, Vic, you go, you're first. And I'm like, I don't want to go first. And it was just a wild time, but it was kind of a neat, talk about bonding and getting to know each other. It was fun. And these were a lot of people I didn't even know, but I knew them after that. So, all right, I'm going to go ahead and bring in Bethany. What's your favorite memory from a conference?
So it was in New Orleans a few years ago, and my nurses were able to go with me, and we had the absolute best time. You want to talk about team building? Like during the day, we learned, and then going out in New Orleans is so much fun. But we left that conference with a greater bond between the office. And I will say after that and being able to bring my nurses, the trajectory of the office changed. And, we got busier but everybody was happier. And it, the team bonding and the camaraderie and I can remember, there was a lot of things at that conference. I learned how to do pessaries, and that's a huge part of my practice now. So I can talk about those things, but the bonding with my nurses and how it really changed the trajectory of the practice is really what stands out.
Yeah, great point. Okay, Andrea, go ahead. Got a favorite moment?
I do. I don't remember what year it was. It was a while ago because I was in my early 20s at the time. And it was the national conference. It took place in Chicago. And the Chicago Metro SUNA chapter really showed up that year. It happened to fall on Halloween. And we were having some sort of event. I know we were having some cocktails and appetizers at that conference. And all of a sudden, the Chicago Metro chapter shows up in full Halloween costumes. They had a thriller dance that was choreographed. And all the members participated in that thriller dance on Halloween in Chicago. And I remember thinking, wow, this is such a cool group. I really want to get involved with it. And it was so fun.
Now, it did have a urology theme behind it because we all had catheters in our hands that we were twirling around.
Yes.
So, but yeah, I mean, I think that's a perfect example of conferences are more than just education. They're bonding moments. Jason, go ahead.
Mine was probably one of the first two that I went to. I was unable to go with any colleagues just due to scheduling. So I remember going by myself and I was just like, oh, this is going to be, I don't really know anybody. I'm still new to urology, but kind of what we talked about before, able to, meet people, create bonds, people that I still kind of text and email with, just for personal and also to just to run things by and bounce things off of. So I think that networking is important. Urology is vast, but I think from an advanced practice provider or nursing standpoint, it is small. So it's a small community. It's nice to be able to create ties all over the country with people. So I think that networking was probably one of the biggest things that had a big impact on me early in my career.
Yeah, and I think that's a good point. You go there, sometimes you're by yourself. You don't have any other colleagues that are there, and this is a way you get to meet new people and that are doing the same thing you're doing, struggling the same struggles that we all have, right?
Correct.
All right, Tabo, I saved you for last. Go ahead.
Okay. I have never been to a SUNA conference. It'll be my first time, but the only conference I've attended is a conference that was in Philadelphia in the year of 2023. And it was right after COVID. We had 11,000 nurses that participated.
Wow.
And the most memorable thing about that conference was they had an opening party. It was like I guess that was on a Wednesday. I can't remember what day, but we got to party with the chief nursing officer and one of the people in the C-suite in the C-suite, and I was actually amazed and humbled because they'll say, you know what, let's go to the dance floor and let's just have fun. Don't think about my title. Just be yourself. Don't worry about, whether it's dancing with the CNO and all that. But I think to me that was very humbling experience.
Yeah, it is kind of neat that people who are in these high positions can be normal people.
Yes.
All right. Well, it's been really great having everybody here to talk about the conference. I think that this is going to be a great conference, as all SUNA conferences are. But I encourage people to attend, and if you can't attend, physically, virtually is always an option. I'm going to go ahead and put a little plug in for next week's show.
Vic Sinise, a seasoned urology nurse and award-winning podcast producer, shares expert tips on recording stunning virtual presentations in PowerPoint. He covers lighting, audio, and slide design for a polished look. Learn how to use PowerPoint's built-in tools for smooth recordings. Discover best practices for engaging delivery and clear visuals. Vic's insights help presenters create professional, high-quality videos with ease. Join us next week to learn more.
So yeah, join us next week to learn. You want to put on a presentation at a conference and you want to find out ways to utilize those PowerPoint slides. I'm going to go through a bunch of new tips and tricks that I learned. So I did a couple of things came in here as we were finishing off. Charlene Vollmer made a comment here. Jeff had something to do with that Halloween dance. Jeff choreographed it. He had a lot to do with that Halloween dance. Gina Polly remembered that event. Oh, it's a crazy thing Chicago does, huh? And Nelsha Glasgow, are there any surgical procedures discussed at this conference, like major cases? Let me bring our crew back in here to answer that one. Whether anybody know of any surgical procedures that are going to be discussed at the conference?
I can take that one.
Righty.
They will be covering procedures that are commonly done by advanced practice providers. To my knowledge, I don't think that they are going to be, covering any major surgical techniques per se in that, but thank you for that suggestion. And we'll definitely take that back to future planning committees to be included.
All right, great. All righty. So let me just go through a couple of last things here. After this show at 10:30 a.m. Central Time, the Euro Patient podcast will go on, and we're going to talk about suprapubic tubes. If you don't know about what they are, now's the time to find out. And also, our newest podcast that just started, Dr. Jeff Albaugh is going to be joining or running the show. He's the host on this Tuesday at 7 p.m., talking about mastering the vacuum erection device, tips for success. I know that Kathy Marchese is also going to be joining him, so it should be a great show. So look forward to learning more about that. And as always, great having everybody on board the show. We're great to see everybody for this little talk about it. Hope we do this every time there's a conference, because I think it's really a neat way to connect with people. And I know a lot of people will be watching this after the show goes on, so be sure to go and join that conference, and we'll see everybody next week.